At Performance Pain and Sports Medicine, we want to tell you our story. We love what we do. Dr. WIEDERHOLZ and I met a long time ago in 2006. He was already a resident in physical medicine and rehabilitation at Baylor College of Medicine, and I was starting my residency. He was one of the chief residents. We were both on our path to doing great things for people. We both went on to pursue fellowships, further study in the field of pain medicine. He went to Georgia and I went to Michigan State University. Originally, he opened his flagship location at Performance straight out of fellowship in Lawrenceville, New Jersey, where he managed that practice and continues to manage a successful practice there. His wife, who's a Texan, wanted to become closer to family, and I, after being employed by a hospital and then being an associate with somebody else for a few years, decided it was time to open my own shop. Although I have kept my academic appointments at University of Houston in the Medical Center, Dr. WIEDERHOLZ and I teamed up, and Performance Pain and Sports Medicine was born in June of 2016. Dr. WIEDERHOLZ, can you tell me more about joining together with me and building our practice?
Sure. So in 2015, we decided, my wife and I, to move back to Houston, which is where I did my residency program at Baylor. And essentially, it took about a year to get the office up and running because we had to do a fit out for the space. And once we got the practice open, everything was humming along, and your practice, which was already a very busy practice, just transitioned over. And we teamed up because things got even busier than they were when you were in solo practice. And so I went and joined you and started seeing patients. And since then, it's been a wonderful experience.
Thank you. It's been a great time. I can't believe it's been 6 years already, and you know, there's so much more on the horizon. We're in our 6th year of practice together, and I feel like we're just scratching the surface. There's so many non-surgical approaches that we employ in our practice that allow us to treat patients from a functional standpoint, to keep them on their feet. The most important being, you know, those small business owners that need to be functional. They need to be at their peak condition in order to conduct business properly. So business owners, kids age 14 and over, all the way up to 100-year-old patients is who we treat. Can you tell us a little bit more about your favorite thing to treat?
Certainly. Well, as a pain specialist and sports medicine specialist, I enjoy really treating everything, anywhere that someone may have pain. However, my passion is probably most at treating spinal pain. And so there are a number of procedures that pain specialists are qualified to perform to help folks with their spinal pain. But I would say the thing that I'm most passionate about at the moment is regenerative medicine. And so utilizing alternative therapies such as stem cells, platelet-rich plasma, and the disc seal procedure, which is a sealant for the discs to halt inflammation coming from the spine, from inflammatory discs. These are non-surgical techniques to try to manage someone's chronic spinal pain. And that, I think, is what I'm most passionate about currently.
That's awesome. So what drove you to do an A4M fellowship in anti-aging and regenerative medicine? It seems like that's such a different field than pain management. However, after reading about it and practicing side by side with you over the years, it really is phenomenal on how we can change patients' lives for the better. Can you elaborate more on how you integrate this in the functional medicine into our practice?
Certainly. So it was a number of years ago that I started seeing patients, particularly middle-aged male patients, with back pain. And at the time, I had a team of physical therapists and chiropractors who did a really wonderful job managing patients with back pain. And it turned out that these folks continued to suffer from pain despite really great therapy. And then I would get an MRI, and it would essentially be normal. And I would scratch my head thinking to myself, well, there's nothing wrong on the MRI. They've been through 8 weeks of rigorous physical therapy, and I couldn't quite figure out what was going on with them. And I started testing them for testosterone. I had gone to a lecture on low testosterone, and some of the symptoms happened to coincide with the things that I saw: back pain, knee pain, joint aches, those sorts of things. And so I started checking, and I noticed that many of these folks had, in fact, low testosterone. At that time, I was referring a bunch of patients out to a local primary care doctor who would manage their low testosterone. And they would come back and they would feel great. And I said to myself, wow, that's a lot of patients that I'm referring out that I could be helping inside my own practice. And so I decided to seek additional training, and that was essentially a 2 to 3 year fellowship in anti-aging, regenerative, and functional medicine, which I then subsequently became board certified in that field, and did a master's degree in metabolic and nutritional medicine. And that now has equipped me with the abilities to manage complex hormonal imbalances and help these folks get well in a natural way.
Thank you so much for that. It has been an amazing journey in learning these techniques and the science behind all of this to help patients' pain and improve their functional quality of life. I am really excited that you share my enthusiasm too, and especially in educating people about what we actually do. Why is our field of pain management so important?
Well, the field of pain management is incredibly important because chronic pain is, or acute and chronic pain represents such a huge problem in this country. Back pain is one of the top reasons to visit your primary care physician. And the lost productivity and lost days at work for people suffering from just back pain alone is astronomical in this country. And so having a specialist who utilizes non-surgical techniques to get people back to work and functioning, I think is really ultra critical for the productivity of the workforce and just overall wellness in our patients.
Thank you for that. You know, the spectrum of back pain is really interesting. Back pain, neck pain, all the joint pains that we see. Some people just think, oh, I just have to go to the surgeon and get an injection and I'll be better. You know, steroid needs to be used cautiously. And really over the past few years, we're really lucky to be on this quest for knowledge as well as the ability to treat our patients with what we now have to offer. Can you elaborate more on the higher level techniques that we perform at Performance Pain and Sports Medicine to help our patients?
Yeah, that's a really exciting part of our field right now. We are living in a time that the field of interventional pain management is evolving rapidly. This is not unlike the field of cardiology when interventional cardiology was developed, when the cardiac stent was invented and cardiologists now started placing catheters into arteries and putting stents in blood vessels to open up those blood vessels that before would require open heart surgery. That's very similar to what we're seeing now in the field of pain management. Interventional pain physicians are learning complex techniques that are bridging the gap between simple injection treatments and major surgery. So now we have these minimally invasive procedures that allow us to take treatments to the next level. So starting with basic injections and then even advancing to minimally invasive procedures that interventional pain physicians are able to implant in a minimally invasive fashion versus an open procedure. For instance, let's look at just spinal stenosis. Spinal stenosis is a debilitating condition that affects mainly elderly individuals who are suffering from arthritis in the spine. And as that arthritis progresses, the spinal canal becomes narrowed. And in the past, that required a big operation to open up the spinal canal, remove the bones that were pressing in on the spinal canal. Now, certain patients are able to get a minimally invasive procedure, such as the MILD procedure, minimally invasive lumbar decompression, which is a decompression procedure done through a tiny, tiny little keyhole. It doesn't even require any stitches. And we're able to remove ligament tissue that's compressing the spinal canal. That's just one example of a procedure that is now in the hands of interventional pain physicians that is preventing major back operations and bridging that gap.
That's really amazing. I am so excited to share all these different technologies that we offer in our coming episodes. I even said to a patient yesterday, you know, I don't just have to prescribe you pain medicine anymore for your knee pain after you had your total knee replacement. I have so many options now. And they looked at me baffled, and I couldn't believe it, that a lot of people don't realize that there's so many options now where you don't have to live in pain. You can be functional again. You can go out dancing again. You can play with your grandkids and your children, and again, conduct your business to the highest level that you can possibly conduct it at, as long as you feel well. I was going to ask you as well, you know, what do you think performance pain in sports medicine, why do you think we're so unique? What do we bring to the table? You always tell me you love what you do, and you know that I love what I do. Why do we continue to love what we do when we see burnout happening around us everywhere with other physicians and other specialists?
Yeah, I think the main reason why both you and I are so passionate about this field stems from that thirst for improving ourselves and constantly learning new things. There are so many physicians that receive their training and then just simply do what they were trained to do, not evolving. This field is rapidly evolving, even in the 10 to 15 years that we've been in practice. And so if you stay on top of things, there's always new procedures that you're learning. Take, for instance, the Vertiflex procedure, another treatment for spinal stenosis. You and I were the first male and first female physicians in the state of Texas to perform that procedure. That shows you the drive that we have to picking up new skills, learning new things, and incorporating that into the treatments that we offer our patients. And so the fact that we're constantly improving, I think, keeps things fresh and exciting. And I think that's the main reason why we don't burn out. We just continue to add new things that keep this field so exciting for the both of us.
I totally agree. It's really unfortunate to see a lot of our colleagues being frustrated, but as you and I are both owners of our own destiny, I like to think of it as, you know, we own our own business, we own our own practice, and we can practice medicine the way we want to. And we do it for the best patient outcomes. We treat our patients as if they're family. We explain things to them, we spend the time with them, and it really is an honor to be a physician. But the more I do this, the more I love what I do, and I know you do too. And it really, it makes my soul feel good, and I know it makes you feel good too. We're always looking for the most optimal outcome for our patients, our staff, our family members, or whoever we treat. But we treat everybody like family at Performance. The other thing I wanted to ask you, you know, you've done multiple board certifications, and this quest for knowledge continues. Do you feel like you're going to be doing any further certifications?
You know, I don't know. I think at the moment, I feel as though I've probably done as much as I would like to do from an education perspective, but who knows? I mean, just look at yourself. You probably thought with 3 board certifications you were good to go, and now you have a new passion with obesity medicine. And so who knows if something similar is going to pop up, and I may have a whole new passion down the road. But at the moment, I think with 4 separate board certifications, I feel as though I'm offering my patients about as much as I can offer them, from traditional treatments to alternative treatments to even natural therapies. And I think that it's really well-rounded. And then adding what you have to the practice just further justifies that I think from a practice perspective, really no one offers what performance pain and sports medicine offers.
I agree. Again, we're really lucky to do what we do, and it's so exciting that we're on the forefront of these cutting-edge technologies that are now available to us. Is there anything else important you'd like the audience to know about us?
Well, I think it's important to kind of know some of the behind-the-scenes things. Dr. Manzi and I both are very passionate about travel, and we support each other tremendously. That's part of the reason we don't burn out. Travel is our rescue, and when Dr. Manzi feels the need to get away and to relax, I'm there to cover the practice, and vice versa. Travel is also my main outlet for relaxation, and so being able to get away and have someone taking over the practice and keeping the patients well taken care of, I think is such a critical thing. I'll just share briefly, in 15 years of private practice, I had never taken a 2-week break from my practice. A week was the maximum time that I ever took away. But now that I have a practice with a partner that I can trust and a practice that is so well run, I felt I could get away for 2 weeks. And that was just a really nice break for me and my family to be able to spend that kind of time away from work. And I just think that that's a wonderful thing. And the patients were well taken care of despite my absence, and vice versa.
I completely agree. Thank you so much for that. I'm honored to be your partner, for us to continue with performance pain and sports medicine for the future, taking care of patients and making everybody as functional as possible. Remember, www.performancepain.com. Follow us on Facebook, Instagram, and LinkedIn. To make an appointment, 346-217-1111 or email info@performancepain.com. Remember, take care of you so you can take care of business.